Good evening and welcome to Tucker Carlson Tonight. I'm Brian Kilmeade. Tucker will be back later in the show with what he describes as one of the weirdest and most memorable interviews he's ever conducted. I don't want you to miss it again. But first, it appears the first round of shutdowns failed to stop the spread of coronavirus. We are sad to report that cases are once again surging in certain hotspots. Politicians are proposing an additional round of draconian measures to combat the spread of the virus. Here's California Governor Gavin Newsom.
We are now effective today, requiring all counties to close their indoor activities, their indoor operations in the following sectors: restaurants, wineries, tasting rooms, movie theaters, family entertainment centers, zoos and museums, card rooms, and the shuttering of all bars. This is in every county in the state of California.
Here we go again. But can we afford the high economic costs of another shutdown? Not everyone thinks so.
Gyms were one of the last categories to reopen under the last shutdown order, and now one of the first ordered to close once again. The owner says he can't endure another round of financial pain, especially in the midst of opening up a new state-of-the-art brand new location nearby.
Our backs are against the wall, and the last one almost crippled me on the last shutdown, and I can't do another shutdown. I just refuse. It's not right. It's not constitutional, and we're standing up for our rights.
By the way, in New York, they still haven't opened. It's not even in a phase. And it's not just local business owners. The measures also bring up fundamental questions about how much power the government actually has.
The governor's latest round of shutdowns now bans indoor activities at houses of worship to slow the spread of COVID-19. Pastor Arthur Hodges says his church just reopened under very strict health guidelines. His church is currently suing the state over the shutdown.
In the U.S. Constitution, in the First Amendment, the first of the First Amendment, the first of the Bill of Rights is the free exercise of religion. And that is an inviolable right. Inviolable means there are no exceptions to this.
So is another round of shutdowns good policy? Can our economy afford this policy? And do we have the trillions of dollars we'll need for another coronavirus bailout? Alex Berenson is an author of this book, Unreported Truths About COVID-19 and Lockdowns. Follow his Twitter feed, find out exactly what he thinks. He joins us now. Alex, this didn't work the first time, so we're going back to it?
It's very strange. There's no real evidence nationally or internationally that lockdowns had the desired effect. You can point to countries that didn't lock down, like Japan, where actually the virus is less, hit less hard than almost any other developed country. You can point to countries that locked down early and hard, like Italy, where there was a terrible, spike in virus deaths. Italy has more per capita deaths than the United States, and that's still true. On the state level, that's also true. And so, if we're going to do this, if we're going to try this again, shouldn't there be some evidence that it actually worked the first time?
41 states have an increase in cases. How else would you attack this? These most sophisticated scientific minds say things as basic as wear a mask, wash your hands.
So first of all, 41 states have an increase in SARS-CoV-2 positive tests, okay? That may or may not be clinically relevant. It's clinically relevant if you wind up in the hospital, if you wind up in an ICU, if you wind up on a ventilator, certainly, if you're one of the unfortunate people who dies from this. If you have a positive test, it does not mean any of those things are likely to happen. And in fact, based on what we know now, if you're under 50, the odds that you will die of this, if you get it, based on data from Sweden, 1 in 10,000. Data from the US, 1 in the low thousands. Okay, for most, I'm not even going to say young or middle-aged people who are decently healthy, or not morbidly obese, not really unhealthy. This is something people get through relatively quickly and easily. So the fact that a lot of people are having positive tests doesn't necessarily mean anything. What matters is if hospitals are filling up, if ICUs are filling up, and let's be clear, we are seeing some of that in the Sunbelt states. We're seeing some of it in Arizona, we're seeing some of it in Texas, we're seeing some of it in Florida. But we're not seeing any signs that those hospitals can't manage the surge that we're seeing. And actually, just in the last few days, and I look at this data very, very closely every day, there's some evidence now that in Southeast Texas, which includes Houston, which is 8 million people, Arizona, that's 7 million people, there's some evidence that that there may have been a peak in hospitalizations. And that's come without the hundreds or thousands of deaths that New York City saw in April. It's a much lower number of deaths.
So when people watching us right now are at home go, hey, Alex Berenson, 135,000 people plus died, and we just got this stat, I don't know where it came from, that if we all wear masks, we'll save 40,000 lives. What do you say to them?
I say that there's no real evidence that masks work. You listen, for 20 years, we and the WHO, the CDC, the WHO have come up with a lot of different recommendations for what to do about respiratory virus pandemics, about influenza pandemics mainly. And they did not really recommend masks. You can go look at their recommendations. There is very, very little evidence that masks work. There's even less evidence that lockdowns work. What we should be doing is concentrating on protecting the really vulnerable. That's people in nursing homes, people with, serious comorbidities, and standing up our hospitals. And that works. That will help people. That will drive down the death rates in people who do get infected. And that's what we should be focusing on.
So Alex, in other words, what the doctors told us in the spring, we should be doing, not what they told us now in the summer we should be doing. Dr. Ronnie Jackson, who is a doctor for 3 presidents, a rear admiral, just won his congressional race, told us today he doesn't wear a mask. He doesn't really recommend you wear a mask. So you can imagine how people watching us right now can say what is the right thing to do and are scratching their head wondering where to go. So we'll continue to monitor it. We'll continue to call on you. Thanks, Alex.
Thanks, Brian.